Did you know that baking soda can help reduce heartburn and improve digestion? But only if you're using it correctly. This common item is often touted for health benefits like reducing heartburn, but incorrect use can lead to health issues. It's a classic case of the dose makes the poison. Let's get into it and make sure we're helping our bodies, not accidentally harming them. Let's talk about pH balance. pH measures acidity or alkalinity on a scale from 0 to 14. Pure water is neutral at 7. Blood needs a slightly alkaline pH of 7.35, 7.45. This narrow range is crucial. Small deviations impact cells and enzymes. Think of it as your body's internal thermostat. Systems like kidneys and lungs maintain this balance. They regulate acids, bases, and carbon dioxide. Blood buffers absorb excess acids or bases. These systems counteract metabolic byproducts and diet. It's a delicate equilibrium crucial for survival. When pH rises above 7.45, it's alkalosis. Metabolic alkalosis can result from excess bicarbonate. Overusing baking soda can disrupt pH balance. It overwhelms natural buffering capacities. Understanding this helps appreciate why more isn't always better with baking soda. How does baking soda shift your body's pH? Bicarbonate is a base. It introduces bicarbonate ions into your bloodstream. This can neutralize stomach acid. But excessive use can overwhelm your body's pH balance. Use it sparingly and as directed. When your body's pH drifts into the alkaline territory of metabolic alkalosis due to something like baking soda overuse, it doesn't usually happen silently. Your body will start to send out warning signals. Initially, the symptoms might be somewhat vague and could be easily dismissed or attributed to something else. You might experience feelings of confusion or difficulty concentrating. Some people report lightheadedness or dizziness. These early signs are your body's way of saying, "Hey, something isn't quite right with our internal chemistry here," and they really shouldn't be ignored if they coincide with increased baking soda intake. As the alkalosis becomes more pronounced, the symptoms can escalate and become more specific and alarming. Hand tremors are a common sign, an uncontrollable shaking of the hands. You might also experience muscle twitching, which can occur in various parts of the body, like the face, arms, or legs. Tingling or numbness, particularly around the mouth or in the extremities, fingers and toes, can also develop. These neurological and muscular symptoms arise because the change in pH and associated electrolyte shifts, which we'll discuss more later, directly interfere with normal nerve and muscle function. If metabolic alkalosis is severe or left unaddressed, the complications can become very serious, even life-threatening. Nausea and vomiting can occur, which ironically can sometimes worsen the alkalosis if stomach acid is lost. Prolonged and more intense muscle spasms, a condition known as tetany, can develop. In the most extreme cases, severe metabolic alkalosis can lead to seizures, an irregular heartbeat, arrhythmias, or even a decreased level of consciousness, potentially progressing to a coma. These are medical emergencies that require immediate attention and intervention to correct the underlying imbalance. Therefore, understanding that something as seemingly innocuous as baking soda can lead to such a serious condition like metabolic alkalosis is absolutely vital. It's not just about discomfort. It's about a fundamental disruption to your body's core operating system. The symptoms are a direct consequence of this disruption. Recognizing them, especially if you've been using baking soda more than usual, and seeking medical advice, is key. This underscores the importance of using any substance, even common household ones, with respect for its physiological effects and an awareness of the potential risks of misuse. Now, closely linked to pH balance, and another area where baking soda misuse can cause trouble, is your body's electrolyte balance. So, what exactly are electrolytes? You've probably heard the term in sports drink commercials, but they're much more than just a buzzword. Electrolytes are essential minerals found in your blood, urine, tissues, and other body fluids. When these minerals dissolve in water, they separate into positively or negatively charged ions. Key electrolytes include sodium, potassium, calcium, magnesium, chloride, phosphate, and, importantly for our discussion, bicarbonate. They are fundamental to life. These charged particles have incredibly vital roles throughout your entire body. They are critical for conducting nerve impulses, allowing your brain to communicate with every part of you. They are essential for muscle contractions, including the steady, rhythmic beating of your heart. Electrolytes also help maintain proper hydration by balancing fluid levels inside and outside your cells, and as we've touched upon, they play a crucial role in maintaining that all-important acid-base, pH, balance. Without the correct concentration of these electrolytes, many of your body's most basic and critical functions would falter or fail completely. The concept of balance is paramount when it comes to electrolytes. Your body needs not just the presence of these minerals, but the right amount of each, and in the correct proportion to one another. Too much of one, or too little of another, can throw the entire system out of whack, leading to a cascade of problems. For instance, sodium is crucial for fluid balance and nerve function, but too much can be problematic. Potassium is vital for heart and muscle function, and even slight deviations in its levels can have serious consequences. It's a delicate symphony, and each electrolyte is a crucial musician. Your kidneys are the primary regulators of electrolyte concentrations in your body. They are like sophisticated filters, constantly monitoring the levels of these minerals in your blood and adjusting their excretion in urine to maintain that precise balance. If you have too much sodium, your kidneys will work to excrete more. If you're low on potassium, they'll try to conserve it. This intricate regulatory system is usually very effective, but it can be overwhelmed by sudden large loads of certain substances or by conditions that impair kidney function, which brings us back to how baking soda can disrupt this harmony. So, how does ingesting too much baking soda specifically lead to electrolyte imbalances? The most direct impact comes from the sodium and bicarbonate components of baking soda itself, which is, chemically, sodium bicarbonate. When you take in large quantities, you're significantly increasing your body's load of both sodium and bicarbonate. This can lead to elevated bicarbonate levels in the blood, contributing to the metabolic alkalosis we just discussed. Simultaneously, the increased sodium intake can in some situations contribute to higher than normal sodium levels, a condition known as hypernatremia, although this is often more complex and related to fluid balance too. The disruption doesn't stop with just sodium and bicarbonate. Your body's electrolytes exist in a delicate interplay. When the level of one changes significantly, it can trigger compensatory shifts in others. For example, there's often an inverse relationship between bicarbonate and chloride levels in the blood. As bicarbonate levels rise due to baking soda intake, your body might excrete more chloride through the kidneys to maintain electrical neutrality, potentially leading to low chloride levels, or hypochloremia. This is part of the body's attempt to correct the acid-base disturbance caused by excess bicarbonate. Furthermore, the state of metabolic alkalosis itself, that higher pH, can independently cause shifts in other critical electrolytes. For instance, alkalosis can cause potassium to move from the bloodstream into the body's cells. This results in a lower level of potassium circulating in the blood, a dangerous condition called hypokalemia, even if your total body potassium hasn't changed. Alkalosis can also affect calcium levels, specifically the ionized, active form of calcium in your blood, potentially leading to symptoms of hypocalcemia, even if total calcium is normal, because less calcium is available in its active state at a higher pH. Therefore, it's not just a simple case of adding too much of one thing. Overuse of baking soda can set off a chain reaction, a domino effect, disturbing the intricate balance of multiple electrolytes. It's like pulling one string in a complex web. The whole structure can be affected. This interconnectedness means that the symptoms of electrolyte imbalance can be varied and widespread, reflecting the diverse roles these minerals play in keeping your body functioning smoothly. Understanding this cascade is key to appreciating the full spectrum of risks. The symptoms you might experience from electrolyte imbalances caused by baking soda overuse can vary, depending on which electrolytes are most affected and how severely. Let's consider hypokalemia, or low potassium, which is a significant concern. This can manifest as muscle weakness, making everyday activities feel strenuous. You might experience fatigue that's out of proportion to your exertion. Muscle cramps, particularly in the legs, can become frequent and painful. In more severe cases, low potassium can even affect the smooth muscles of your digestive system, leading to constipation or even a dangerous slowing of intestinal motility called ileus. Then, there's the impact on sodium and calcium. While significant hypernatremia, high sodium, from baking soda alone is less common unless fluid intake is also restricted or there are kidney issues. Any substantial increase in sodium load is a concern, especially for blood pressure, which we'll cover later. More directly related to the alkalosis from baking soda is the effect on ionized calcium. When active calcium levels drop, you might experience symptoms like tingling or numbness, especially around the mouth or in the fingers and toes, similar to some symptoms of alkalosis itself because they are interconnected, as well as muscle cramps and spasms, sometimes severe. Perhaps one of the most serious risks associated with electrolyte imbalances, particularly involving potassium and calcium, is the potential for cardiac complications. Your heart muscle relies on a precise balance of these electrolytes to conduct electrical impulses and contract properly. Imbalances can lead to an irregular heartbeat, known as an arrhythmia. These can range from palpitations or a feeling of a skipped beat to more serious and potentially life-threatening rhythms that can impair the heart's ability to pump blood effectively. This is a critical reason why maintaining electrolyte balance is so important. Finally, severe or rapidly developing electrolyte imbalances can also affect brain function, potentially leading to confusion, lethargy, and in extreme cases, seizures. This is because electrolytes are crucial for normal nerve cell activity in the brain. When these levels are drastically out of sync, it can disrupt the brain's electrical stability. So, you can see, the consequences of disrupting your body's electrolyte harmony are far-reaching and can be very serious. It's another compelling reason to be extremely cautious with how much baking soda you ingest, and to avoid using it as a regular supplement without medical guidance. Let's dive into the sodium connection in baking soda and its impact on blood pressure. Sodium in baking soda is the same as in table salt, affecting blood pressure. Excess sodium leads to water retention, increasing blood volume and pressure. Chronic high sodium intake can cause hypertension and cardiovascular issues. Be mindful of sodium sources, including baking soda, to maintain heart health. Certain groups are particularly vulnerable to the blood pressure-raising effects of sodium, including those with hypertension, older adults, and individuals with kidney conditions. It's crucial for these groups to monitor their sodium intake, including from sources like baking soda, to avoid complications. How can we mitigate the risk of high blood pressure from baking soda? Awareness is crucial. Baking soda contains over 1,200 milligrams of sodium per teaspoon. This can easily push you over the recommended daily limit. Consider safer alternatives for heartburn and consult your doctor for recurring issues. Regularly monitor your blood pressure, especially if using baking soda. Let's discuss the potential for kidney damage from long-term misuse of baking soda. Our kidneys filter blood, removing waste and maintaining a balance of water, salts, and minerals. Excessive sodium from baking soda can strain this delicate system, impacting kidney efficiency. Healthy kidneys adapt, but chronic overloads can cause long-term damage. Understanding this helps us explore baking soda's impact on kidney health. Now, let's connect this directly to baking soda. Consuming large amounts of baking soda introduces excess sodium bicarbonate into your system. The kidneys work harder to excrete this excess, increasing their filtration rate. Chronic overuse can lead to kidney fatigue and reduced function. It's like running a marathon without rest. Over time, this strain can cause significant kidney damage. Protect your kidneys by using baking soda in moderation and consulting your doctor. Avoid long-term high-dose consumption. Stay hydrated and get regular checkups, especially if you have risk factors like diabetes or high blood pressure. Now, we arrive at a particularly alarming, albeit rare, potential consequence of baking soda misuse: stomach ruptures. This sounds dramatic, and it is, but it's rooted in basic chemistry. Baking soda reacts with stomach acid, producing carbon dioxide gas. Excessive gas can lead to rapid pressure buildup. This can cause acute gastric distension and potential rupture. Proper dosage and timing are crucial. The human stomach can expand to hold up to 4 liters, but excessive gas production, like from too much baking soda, can force it beyond its limits. This rapid distension can cause severe pain and even a life-threatening rupture. Always use baking soda cautiously to avoid these dangerous outcomes. Recognizing the warning signs of severe stomach distension is critical. Symptoms include sudden, excruciating abdominal pain, severe bloating, and nausea. Immediate medical help is essential. Prevention involves using baking soda cautiously and consulting a healthcare professional for persistent issues. Baking soda can interfere with medications by altering stomach pH, affecting drug absorption. It neutralizes stomach acid, making the environment less acidic. This can reduce the effectiveness of certain drugs. Always consult your doctor before using baking soda with medications. Now that we understand the general mechanisms, let's get into some specific examples of drug interactions with baking soda that you should really be aware of. It's not an exhaustive list by any means, but it covers some common scenarios. For example, if you're taking certain antifungal medications, like ketoconazole or itraconazole, which are often prescribed for serious fungal infections, these drugs absolutely require an acidic environment in the stomach for proper absorption. If you're simultaneously using baking soda, it can raise the stomach pH to a point where these antifungals are very poorly absorbed. The consequence? The levels of the antifungal medication in your bloodstream could be too low to effectively fight the infection, potentially leading to treatment failure, which can have serious health implications. Another area of concern is with iron supplements. Many people take iron to treat or prevent iron deficiency anemia. Similar to the antifungals I just mentioned, iron is generally better absorbed in an acidic environment. The acidity helps to keep the iron in a soluble, more absorbable form. If you're taking baking soda, particularly around the same time as your iron supplement, it can decrease the acidity of your stomach, thereby reducing the amount of iron your body can actually absorb. This could make your iron supplementation less effective, meaning your anemia might not improve as expected, or you might need higher doses, which can come with their own set of side effects like constipation. It's a frustrating cycle where you're trying to do something good for your body, but an interaction is undermining your efforts. It's not just about absorption from the gut. Baking soda can also affect how your body eliminates certain drugs, primarily through the kidneys by changing your urinary pH. Sodium bicarbonate makes your urine more alkaline. This change in urinary pH can significantly alter the rate at which certain drugs are excreted. For example, acidic drugs like aspirin, salicylates, or phenobarbital tend to be eliminated more quickly when the urine is alkaline. This means the drug might not stay in your system long enough or at a high enough concentration to do its job effectively. Conversely, For basic drugs, such as amphetamines, used for ADHD, or quinidine, a heart medication, an alkaline urine can slow down their excretion. This can cause these drugs to build up in your system, potentially leading to increased side effects or even toxicity. Always consult your doctor or pharmacist before using baking soda with medications. They understand your medical history and can assess risks and benefits. Do not self-prescribe. Follow their guidance for safe use. Let's dive into a critical point for those managing heart conditions. Baking soda, or sodium bicarbonate, can worsen heart issues. The key player here is sodium. 1 teaspoon of baking soda contains over 1,200 milligrams of sodium. This can be close to the daily limit for heart patients. Excess sodium increases blood volume and pressure. This strains the heart, especially in those with pre-existing conditions. Discuss any use of baking soda with your doctor. Let's delve into how excess sodium from baking soda strains your heart. Sodium makes your body hold on to water, increasing blood volume. Imagine your blood vessels as pipes and your heart as the pump. More fluid means the pump works harder, straining the heart. This can worsen heart conditions, leading to fatigue and shortness of breath. Managing sodium intake is crucial for heart health. Let's consider some specific heart conditions and how baking soda's sodium content can be particularly problematic. Take congestive heart failure, or CHF, for example. In CHF, the heart isn't pumping blood as effectively as it should. A key goal of CHF management is to reduce fluid overload to ease the heart's workload. Consuming baking soda, with its high sodium load, directly counteracts this goal by promoting water retention. This can quickly lead to a buildup of fluid in the lungs, causing severe shortness of breath, or in the extremities, causing significant swelling. For CHF patients, even a single large dose of baking soda could potentially trigger a significant worsening of their symptoms, possibly requiring medical intervention. Then there's hypertension, or high blood pressure. Millions of people manage this condition, often with medication and dietary changes aimed at lowering sodium. If you're taking baking soda regularly, perhaps for heartburn, you might be unknowingly sabotaging your blood pressure management efforts. The sodium in baking soda can directly raise your blood pressure, making your medications less effective or requiring higher doses. It's like trying to bail water out of a boat while there's still a hole letting more water in. Consistent high blood pressure, as we know, is a major risk factor for heart attacks, strokes, and kidney disease. So, any factor that elevates it further, like unaccounted for sodium, needs careful consideration. What about arrhythmias, or irregular heartbeats? While the primary concern with baking soda is its sodium content, very large doses could potentially disrupt the delicate balance of electrolytes in your body, including potassium and sodium, which are crucial for normal heart rhythm. Significant shifts in these electrolytes can, in susceptible individuals, trigger or worsen arrhythmias. While this is more likely with extreme overuse leading to conditions like metabolic alkalosis, it's another layer of risk for those with pre-existing tendencies towards irregular heart rhythms. The heart's electrical system is sensitive, and maintaining electrolyte balance is key to its stable functioning. So the overarching message here is one of caution and consultation. If you have any diagnosed heart condition, whether it's heart failure, high blood pressure, a history of heart attack, valve disease, or an arrhythmia, you absolutely must speak with your doctor before using baking soda internally for any purpose. Don't assume that because it's a common household item, it's universally safe. Your doctor understands your specific condition, your medications, and your overall health profile, and they are the best person to advise you on whether baking soda use is appropriate for you, and if so, in what extremely limited, if any, capacity. Your heart health is too important to risk with self-treatment without professional guidance. Now, let's shift our focus to your skin. Baking soda is often used in DIY beauty recipes, but it can cause skin irritation. Healthy skin has an acid mantle, a slightly acidic film that protects it. This balance is key to resilient skin. Baking soda is alkaline, disrupting this balance. This can weaken your skin's natural defenses, leading to dryness, irritation, and vulnerability. Let's get more specific about how this alkaline nature of baking soda translates into skin irritation. One of the immediate effects of applying an alkaline substance to the skin is the stripping of its natural oils, also known as sebum. Sebum is essential for keeping your skin lubricated, moisturized, and protected. Baking soda, due to its alkalinity and sometimes abrasive texture when used as a scrub, can effectively dissolve these protective oils. This leaves the skin feeling tight, dry, and exposed. Over time, this chronic dryness can lead to flakiness, rough texture, and an overall dull appearance, which is often the opposite of what people are hoping to achieve. With the skin's protective oils diminished and its acid mantle disrupted, the barrier function is significantly weakened. This is like leaving the gates of a fortress undefended. Your skin becomes much more vulnerable to everyday environmental stressors that it would normally fend off. Things like pollutants, fragrances in other products, or even changes in weather can now cause a more pronounced reaction. The skin's ability to repair itself can also be impaired when its natural pH balance is consistently thrown off, making it harder to recover from any irritation or minor damage it sustains. This increased permeability is a key factor in developing sensitivity. The symptoms of skin irritation from baking soda can vary in severity depending on your skin's sensitivity, the concentration of baking soda used, and the duration of contact. Common signs include redness, a persistent itching sensation, or a stinging or burning feeling upon application or shortly thereafter. You might also notice the development of dry, scaly patches, or even a rash resembling contact dermatitis. In more severe cases, especially with prolonged use of concentrated baking soda pastes, it can lead to what are essentially mild chemical burns, further damaging the skin and requiring time to heal properly. It's also crucial to remember that everyone's skin is different. Some individuals might use baking soda topically, with minimal immediate issues, particularly if their skin is very oily or resilient. However, for many others, especially those with naturally dry skin, sensitive skin, or conditions like eczema or rosacea, baking soda can be a significant irritant. Even if you don't experience an immediate reaction, repeated use can cumulatively damage the skin barrier over time, leading to increased sensitivity and problems down the line. The absence of an instant burn doesn't mean it's harmless in the long run. Baking soda frequently appears in DIY skincare recipes found online, often promoted as a cheap and natural alternative for various concerns. However, its abrasive nature and alkalinity can be too harsh for facial skin or sensitive underarm areas. Many DIY recipes overlook the fundamental chemistry of skin health and its delicate pH balance. For safer alternatives, consider pH-balanced products and consult a dermatologist for targeted treatments. Baking soda is useful, but can pose health risks if overused. Consult healthcare professionals before using it as a remedy. Moderation and awareness are key. Your health is your most valuable asset. Please share your experiences in the comments. Like, subscribe, and stay healthy.